To catch you real quick, we just finished this conference, and you've been very, very helpful. You were talking about the cardiac electrical signal, and that's because you're a cardiac surgeon, right? What's your real title? How do you describe yourself before in your past life?
I'm still board certified in cardiothoracic surgery.
There you go.
But now with my new neuropathy boards, I probably have now dropped those since I'm no longer actively practicing cardiothoracic surgery.
Good. Now you've got some experience because you actually wrote a paper about the ReBuilder.
Yes.
So you've got some significant experience on it. So you must feel that it's working okay. You wouldn't have written a paper, obviously.
I'm not so sure if I can say that's the reason I'm so favorably impressed with it. I fortunately was in on the ground floor and have seen a couple of hundred patients in Dr. Howe's and Dr. Tim Hartlett's practices treated with ReBuilder. So it's not just the reports of the patients that were collected that purchased the ReBuilder, it's the ones that we're treating in the clinics now. I see very few failures.
Does a case come to mind that it might be interesting?
It appears to me to be, unfortunately, the case that come to mind are 2 or 3 failures. But one I mentioned earlier today, a very morbidly obese, severe diabetic, with no sensation whatsoever. It took months, but eventually he did develop significant recovery and sensation. And that was a remarkable case. But and also another woman who had multiple sclerosis. We
Really?
didn't expect it to work with her, but she'd had a significant amount of improvement. Now significant, maybe 20–30%, but she was walking better when she came to the office every day. And so there are many anecdotal cases. I just need to put all that information together.
Oh yeah, and you're working on a new study now with a couple of hundred where you've actually got nerve conduction velocity test before.
Yes,
That's
every patient
that's going to be
has
interesting.
been treated in this consortium now, Experience Health and Wellness, or Superior Health and Wellness, I think is our current umbrella for all 3 practices. Every patient gets a nerve conduction velocity test. It may not be done prior to their starting therapy, but they will have it early in the course of their therapy.
Good. That's going to be interesting. All right, well thanks, I appreciate it.
Okay, thank you for
I really do appreciate your presentation of the